Nearly 3 billion people have had to live in various forms of lockdown since the coronavirus pandemic struck. The restrictions continue to have a major impact on the mental health of many of those people. A survey by the UK's Mental Health Foundation found almost 1 in 4 adults questioned had feelings of loneliness during lockdown. That figure was 1 in 10 shortly before lockdown. For those aged between 18 and 24, the lockdown figure was 44% compared with 18% before lockdown. Italy's Order of Psychologists found 8 in 10 Italians surveyed needed psychological support to get through the pandemic, while a study in one Ethiopian state found a third of people had symptoms consistent with a depressive disorder, a 14-fold increase compared to estimates before the pandemic. Bilal Hassam works in the UK's National Health Service and is leading the COVID-19 response for the international humanitarian charity PennyAppeal. He joins us live now via Skype from Leeds. Sir, thank you so much for joining us here on Al Jazeera. What is it specifically about the lockdown that has proved so damaging for so many people's mental health?
Well, your lockdown really is an unnatural state. And right at the beginning of the crisis, you saw world leaders from across the planet refer to the coronavirus as putting the world on war footing, that we hadn't seen such measures taken since the last world wars. Well, war brings with it trauma. It brings with it fear of harm. It brings with it restrictions of movement. And all of this has been paralleled by the lockdown. So we've really experienced to a degree what soldiers might be experiencing on the ground. And what we know of war is that what comes after is post-traumatic stress disorder. And what we feel and what I feel is that coming out of the lockdown, we can expect that many people to exhibit very similar symptoms to post-traumatic stress disorder, perhaps a post-lockdown disorder.
And what could those symptoms be like? What could they be?
Well, it's sort of a range of different sorts of symptoms. PTSD is most commonly associated with negative thoughts, sometimes difficulty sleeping. It can lead to destructive behavior like substance abuse, neglect, low mood and depression. And these are already things which people in lockdown are reporting. We're seeing an increase in suicide ideation, an increase in use of helpline services like the one that we run at PennyAppeal, where people's well-being and people's mental health is really being impacted.
Which groups are more vulnerable? Because we looked at one study where actually it was younger people, the 18 to 24-year-olds, that were particularly hit by mental health problems.
Absolutely. We're social people, and young people in particular, they're the most socially mobile. They're moving around. They're seeing their friends in their workplace. People at university and schools, those spaces are often safe spaces that allow you to process your life and allow you to connect outside of your home bubble. So when you're stuck at home, and if you just think about it, children in particular are so vulnerable. They, if you were to keep a child at home, if you were to stop them from seeing their friends, take them away from school, you would be guilty of child abuse in a normal circumstance. So we're really expecting young people to be impacted significantly. And so the support really needs to be there for them.
You've made the comparison within the sort of, potentially having PTSD post-lockdown to soldiers coming back from a war and what they've experienced. But of course, the difference is that lockdown here was a shared experience. The whole of society was under the same constraints. So does that make it easier or worse when it comes to actually being able to help friends that you might see are probably struggling?
Yeah, well, it's a mixture. It's a mixed picture, no doubt. Soldiers often, they come out, they travel in battalions, and a sense of fraternity and brotherhood and sisterhood is really important as we come out of this lockdown. And even during the lockdown, we need to take those measures where we reach out to friends in the limited ways that we can, and reach out to family members so that we can connect, so that we can talk about our experiences. The challenge, however, is that those individuals who are perhaps most vulnerable, the elderly, young people who are isolated, students who are isolating alone, or who perhaps might have elderly parents that they can't visit, those are going to be even more vulnerable now given COVID.
Of course, the COVID-19 crisis hits on many levels. Financially, a lot of countries are heading into recession, of course, when it comes to physical health because of the effects of COVID itself. So do you think that enough attention and I guess enough funds are being directed at the mental health side of this?
Well, look, the last recession that hit the world resulted in just in the US and the UK alone, approximately an additional 10,000 suicides. Now, that was just an economic crisis. We're experiencing a health crisis on top of an economic crisis, on top of a social crisis, and in many places a political crisis. So we can expect waves of individuals, people who never, ever thought they would need support with their mental health, requiring additional services. So one short-term measure will be bolstering those mental health provision, bolstering mental health services across countries. But perhaps more importantly are going to be non-traditional providers. We as a charity, Penny Appeal, we run a helpline service, especially for people who feel their mental health has been impacted by COVID-19. We're going to need cultural solutions. We're going to need economic solutions. The Prime Minister of New Zealand has already talked about having a 4-day week. We're seeing many countries who are now really embracing the idea of a universal basic income. All of these different aspects are going to play into the individual and societal mental health.
Yeah, I guess all of that could be part of the new normal that we keep on hearing about. Bilal Hassam, COVID-19 leader at Penny Appeal, an international humanitarian charity. Thank you so much for sharing your expertise with us and highlighting this issue.
Thank you.